Hi, this is Mackenzie, foodborne epi at ADHS, and I want to show you how to use the case contacted table for enteric disease investigations. So the purpose of this table and the reason that we're requesting all enteric disease investigators use this table is so that we can capture the attempts and completed interviews. So our goal is to increase timeliness of when these interviews are being completed. And in the future, the goal is to have all Shiga toxin-producing E. coli cases completed within 3 business days and Salmonella cases completed within 5 business days. Now, obviously, we'll start out slow here. We realize that this is going to be a stretch for some folks, but those are our goals. And as we're pulling information to see which cases have been attempted to interview and completed interviews, we will email you and let you know if there is a list of outstanding cases that need some attention. And with this, we will also offer our assistance. We have a centralized enteric disease interview team that is always able to help counties if you are falling behind, and tribal jurisdictions as well. So when we're in MEDSIS, we go to case management, and we go to the case contacted and interviews table. Now, there's nothing in here right now, so I'm going to show you how to use it. The first thing I want to go over is, what is an interview attempt? Well, what it is not is an attempt to get information about the case, such as a copy of a lab report or medical records. So certainly we encourage you to put all activities related to an investigation into this table, just because it helps us know what's going on without having to email you. So let's say we call Sally's provider and we're asking for medical records. This is not considered an interview attempt, so we're going to say no, and we're going to save it. So there it is right there. Doesn't have any information about whether the interview was attempted or completed. Now let's imagine we're in a dream world and Sally is waiting at home for us to call her, and she answers the phone right away and we're able to complete an interview. So this is our best case scenario. We would note that we completed interview with the case. And I want to bring your attention to something that's really useful here. We have these question marks that you can hover over. And this is going to explain to you what type of information we're looking for when we ask you the question. So we consider an interview attempt anytime you are trying to get this person to answer the questions that you have. So this could be leaving a message with the patient or a proxy via voicemail, sending a text message, an email, or a letter. This is your attempt to get your exposures assessed. So when we call her to talk to her, yes, that is considered an interview attempt. And it's dropping down to ask you what type of questionnaire that was used. So your standard questionnaire, again, these buttons are here to tell you what they are. Standard questionnaire is going to be our DSO. This is typically the first questionnaire that you're going to ask people, the most common questionnaire that you're going to do. There's also the HGQ, or oftentimes you'll hear us call it the NHGQ, National Hypothesis Generating Questionnaire. This is a pretty extensive questionnaire, usually between 14 and 18 pages, asking for a lot of exposures. The third is a supplemental focus questionnaire. This is also going to be outbreak related, and it's going to be something that's a little shorter than the HGQ, and it's going to be a little more honed in on specifics of an exposure. And then finally, other is going to be used the least frequently. That's probably going to be something like a case control study questionnaire or an open-ended questionnaire, which are oftentimes administered by CDC. So we'll say, yes, we completed the standard questionnaire, and our drop-down asks us, did we finish it? Now, what is completed? Again, we can go to our question mark, and this is if at least 75% of the questions on the questionnaire are answered, we would call this a completed interview. If you have, for example, talked to a case for about 5 minutes and got through part of the questions, and you have plans to speak with this person at a later date, either you're going to call them back or they're going to call you back, this probably would not be a completed interview because you haven't answered 75% of the questions. However, if you attempted to ask all the questions and they said don't know to everything, and you don't anticipate talking to them again, that also isn't a completed questionnaire. If you're unsure, remember that it is just an estimate of that 75%, and we want you to give your best effort on answering all the questions. So with Sally, we again had luck. We talked to her. We tell who it was interviewed by, and we save. And up here, it's going to have our notes. It's going to tell us who interviewed. It's going to have the date auto-populated of the time that we finished this interview. So same thing. Let's say we want to leave Sally a voicemail. We're going back in time and pretending that Sally wasn't waiting for us. So we can say left voicemail for the case. This is an interview attempt. Like we said, we were really hoping she would answer the phone. Again, standard questionnaire, but this time we did not complete it. And again, we enter in who was attempting the interview. So let's say that Sally calls us back. She got her voicemail. Instead of editing our attempt here, we're going to add a new attempt, and we'll just say, spoke with case for interview. Again, this is our interview attempt. We completed the standard questionnaire. It was definitely done this time, and we go through the same process. The same thing's going to happen if we use a text message. Now, we do strongly encourage you to text your cases if you can't get a hold of them via phone. A lot of people don't check their voicemail. They often screen their calls, and we're calling from weird numbers they may not recognize. So we always encourage you to use that to your advantage. We've had a lot of luck here at ADHS. So we would say sent text to case. This is considered an interview attempt in hopes that they would call you back right then. We'll call this not completed, but the attempt was made not by MEDSIS test. So if the case calls us back the next day, the next week, whatever it may be, we're going to, again, we'll call that a text message, or no, let's call that a phone, because we conducted it via phone, and we'll say case returned call after text completed interview. This type of contact method doesn't really matter in this case. I'm choosing phone just because that is the most accurate way, because we didn't actually complete the interview via text. Again, this is an interview attempt. It is a completed questionnaire. And that is that. So with this, the processes for doing the NHGQ, a focus questionnaire, an open-ended questionnaire or interview are going to be the same as these others that we've put in here. What we're again looking for is the date of attempt. So when we have these completed no's, these are considered attempts. That's the first point of contact. We want to make sure we're doing that quickly, trying to get the ball rolling. And then when you see yes completed, that's the day we're going to say, okay, this person is finished, the interview is done, we can start looking at this data. So both of these dates are going to be really important to put in here. So in the future, please be on the lookout for emails. We'll be beginning this process soon once we get everyone used to using this table. We may email you in the beginning to say, hey, we noticed you're not using this table, please put this into practice. And then in the future, we'll be saying, hey, these interviews are getting close to the time that they need to be interviewed. Again, that's 3 business days for STEC and 5 for Salmonella. And as always, we are here to help you. You can email us at food@azdhs.gov. We can help you figure out how to answer the case contacted table, or we can help with interviews. So we appreciate you using this, and we're here to help.